Good to go. Good morning, Queensland. I can report today that we've had one new case overseas acquired. This case has been detected on board the MV United Grace, which has travelled from Japan, and we have two historical cases. This brings our active cases in Queensland to 16, and I can report good news that our last community acquired case out of the most recent clusters in Queensland has now left hospital, so we have no remaining patients who are positive in hospital from the locally acquired community clusters. The only patients we now have in hospital are our international COVID patients. We did 8,255 tests over the last 24 hours and 2,347 vaccinations. Putting this into context, the world's now seen over 145 million cases and over 3 million deaths, and very sadly we have seen globally 894,043 new cases in the last 24 hours, in which India has reported 332,730. So more than a third of all global cases reported in the last 24 hours have come from India. Now, as we all know, Western Australia made a decision late yesterday afternoon, to make a decision to lock down the Perth and Peel regions for 3 days. That means Queensland has made the decision to also ask anyone who has been in Perth or the Peel regions on or from the 17th of April, who were in Queensland before midnight last night, to test and to quarantine for those 3 days, complying with the same directions as the Western Australia lockdown. So only leaving home for certain reasons, and of course that would be after a negative test, but should be in quarantine for those 3 days. Anyone arriving in Queensland from midnight last night are now required to go into hotel quarantine for up to 14 days. And of course anyone who is not a Queensland resident will be required to have an exemption to arrive in Queensland. There are many flights expected today. I'm still getting the number of flights, but there were flights due to come into Brisbane and Cairns and elsewhere around the state. So that message is important to get out to those people who are looking at travelling, either direct from Western Australia or through other jurisdictions into Queensland, and have been in the Perth or Peel region since the 17th of April, that you will be going into hotel quarantine and you will need an exemption if you're not a Queensland resident. I'll ask Dr. Young to just talk about the circumstances surrounding the one new positive case in Queensland today, and of course how these lockdowns occurred. We know that there's been two positive cases, one gentleman who was in Perth and then travelled on a flight from Perth to Melbourne, and I understand the Victorian government is now doing contact tracing for people who were on that flight. So we do ask for people to stay alert, anyone who has been travelling from Perth to Melbourne, for the flight details of that flight. Also, if you have been in Melbourne, looking at whether you've been, in Perth or Peel, any of the venues that the Western Australia Health Authorities will be listing on their site where the gentleman had been. So please, if you have been in Western Australia, please check out the sites and the venues to see if you are a close contact and have been at any of those sites. I'll now ask Dr. Young to comment further.
Thank you, Minister. Yes, so we have one new confirmed case diagnosed in Queensland overnight, and that's a seaman on a vessel that travelled from Japan and is now off the coast of Queensland, off the coast of Mackay, and we're just working through with that vessel what happens going forward. So everyone on that vessel has been tested and one person is positive. And we've done that many times before, so we'll do that again. Then we have two historic cases that we've identified, and we're just further investigating the circumstances around those two cases. Neither of them are shedding virus at this time. They're both PCR negative, so there's no risk there. Then, of course, we have the issue from Western Australia yesterday, that very late notification that they were going into lockdown due to having a case that had been infectious in their community from the 17th of April through to the 21st of April when that person travelled to Melbourne. They have infected one person in the household they were staying with in Perth, and the West Australian government made the decision to lock down their areas, both the Perth and the Peel regions, for 3 days from midnight Perth time last night while they work out what the ongoing risk is. So therefore we have then, as have most states and territories across Australia, made the decision that the safest way forward is that we decrease movement from Western Australia to other states and territories, so people should not be leaving the Perth or the Peel regions, except for very few numbers of exemptions. So they shouldn't be coming to Queensland, but any who do come, if they are Queensland residents, of course they can return and they'll be going into quarantine. If they're not Queensland residents or permanently moving to Queensland, they'll need an exemption to come into Queensland and will also need to quarantine, just while we work out what the ongoing risk is. It is the B117 variant, we suspect, that's involved here, because that is the variant that was being transmitted to another group of people within that hotel quarantine, where it's assumed that this gentleman was infected. So we don't definitively know that, but we believe that to be the case. That's why we need to be particularly cautious about any people who might have been exposed. Then, of course, anyone who's been in the Peel region or in the metropolitan Perth region since the 17th of April or subsequent to that, when they do come into Queensland, although we're asking them, of course, to stay at home, it's particularly important that they do not attend any of the Anzac Day events that are being held this weekend, or indeed any other event. They really must stay in their own accommodation and not leave until those 3 days are up. So that's very important going forward. Then I would also like to briefly mention the fact that TGA came out late yesterday and mentioned that they have now looked at 3 additional cases that they believe are linked to the AstraZeneca vaccine that was given to those 3 people. It's not absolutely confirmed, but their advice is they believe that the most likely cause for those 3 people to develop the clots they did and the syndrome they did was from that dose of AstraZeneca vaccine. One of those is a Queenslander who was vaccinated and then subsequently developed a clot, presented to hospital, has been managed and has been discharged and is now in ongoing treatment, but is well and is recovering, which is very good news. Those other 2 new cases, one was in Victoria and one in New South Wales, and both the TGA and ATAGI and the Commonwealth Government have put out information about those cases. It has not changed the advice about what people should do in terms of coming forward to get vaccinated. Thank you.
Well, I can't see how it's overreaction when just about every other state and territory in Australia are doing the same thing. The AHPPC met last night, considered this as a high risk, and that every other state and territory other than New South Wales is putting in place similar measures to Queensland. Well, I disagree with that statement. The people of Queensland have a lot of faith in the advice that they're receiving. They have put their faith and confidence and trust in the advice that we get from the Chief Health Officer and that we give to the people of Queensland to keep them safe. I would have to say there was never a more important time to follow these directions. We have Anzac Day coming up tomorrow. I wouldn't consider for a moment putting those people at risk because we want to attend those services. We owe it to our ex-servicemen and women to make sure that people who have travelled to Perth are staying quarantined at home in a hotel quarantine, so we are reducing the risk as much as we can. Now, we've set up to 14 days, as we have seen before. If over the next 3 days at the end of the lockdown, if Western Australia lifts their lockdown in 3 days and there's no more community transmission, we will take the advice of the Chief Health Officer as to whether we need to continue the quarantine. But at this stage, this is the same measures we have taken, so it shouldn't be a surprise to people. We have put the same measures in place for clusters in recent time. We are seeing more and more hotel quarantine breaches and transmission. We are seeing more of the B117 variant, being the UK strain that we know is more infectious and contagious. So we have to take these measures. We cannot afford to fall down now. We have done so well as a country and a state for over 15 months. We cannot afford to take the risk now and to become complacent. Well, why would we test out other things other than hotel quarantine when we know that the large majority of our cases in Australia are coming from international arrivals and through hotel quarantine? We can't afford to take the risk. The majority of the population in Queensland and Australia are not vaccinated. We should not be reducing our measures now. The risk is as great today as it was 6 months ago, and we must ensure that we keep the community safe. And in fact, the risk has increased because we are seeing these new variants that are more contagious come on shore. So we have to take the measures that we are. We're doing everything possible, and I want to thank the Queensland Police Service and Border Control who are managing the flights coming in, and for all those people who we know that people would prefer not to be quarantining, but this is essential. As I just said, we are seeing over 300,000 cases in 24 hours from India. This shows this is just as real today as it was last year. They have been in an area that has been deemed a hotspot by Western Australia and has been put in lockdown. And just as when Queensland has had their lockdowns, that other jurisdictions have taken measures to restrict people travelling from Queensland to other jurisdictions while we had our lockdown, you would expect when another state has a lockdown, we would do the same as far as people arriving here. And I think everyone in Queensland would expect us to. If we were to simply say, that's Western Australia's problem, we have no risk here, despite many flights having arrived in Queensland since the 17th of April and are due in today. We're not talking 1 or 2 flights, we're talking many passengers coming in from an area that is currently in lockdown. So we respect the advice and the decision made of Western Australia, and we are following a similar position as just about every other state and territory in Australia. We hope they can play. We really hope that they can play, but let's wait and see what comes of the next 24, 48, 72 hours in Western Australia. Our safety of our Queenslanders have got to come first. As safety of the Queenslanders have got to come first. We will work through that. We're not going to get ahead of ourselves. Let's look at what the next 72 hours shows as far as whether there are any other cases in Queensland. Oh, well, look, that's a decision of the Queensland Reds. We will work with them as we work with any other sporting body. But right now, we've put these restrictions in place and we want to see what comes of the 3-day lockdown in Western Australia. Look, I think it's unfair to say that we're not moving fast. We know these are really complex issues. There are many changes that have been made over the last 6 years to our legal system, to the number of offences around domestic and family violence, to support for people in the community, new shelters established. It is a difficult area. To say that we can introduce one more new law and suddenly we're going to stop this sort of behaviour and violence by individuals, this requires a cultural change, a change in healthy relationships and respect. The fact is, when someone decides that they're going to take the life of their loved one, they're not thinking, how long will I spend in prison? That's not a thought that goes across their mind. So we need to make sure that we get these laws right. Coercive control is a major problem. We know that it can lead to the worst outcome in domestic and family violence. That's why we have to get this right, because those who want this to occur quickly also know that there's very few countries that have legislated for coercive control and have been successful in having any sort of prosecutions because of the definition and how you define what is coercive behaviour. So we have to get this right. There's no point looking good by just simply creating a law that doesn't work and doesn't lead to prosecutions and doesn't make victims any safer. So let's make sure we get this right, and we can do that by working with the community and the stakeholders. Yes, well, Dr. Young just said that he was released from hospital and is doing well.
Yeah, so sort of a background to it, like was it a few days after?
Oh, I'll get Dr. Young to comment on that, thanks.
Doctor, was it just a few days after? Like,
So he's a 49-year-old male. He was vaccinated on the 29th of March at a general practice, and he developed some symptoms on the 8th of April and then was diagnosed in hospital on the 17th of April with a clot in his leg, and then was discharged on the 18th of April and is now on some ongoing medication and is well.
as a medical professional, can I ask you your concerns about the research you've done and you've seen?
So we've now seen 6 events of people who have developed clots that is thought to be related to the vaccine. We know that people every single day develop clots. We see a lot of those across Queensland and across the world, of course, but with these are clots that are a direct consequence of the vaccine. But it is a very rare consequence. So to date in Australia, we've given around 1.1 million doses of the AstraZeneca vaccine, and we've seen these 6 incidents as a result.
There were reports earlier this week was that the uptake of AstraZeneca wasn't going as quickly as people were concerned about the clots. Are you concerned about that?
I think it is really important that anyone in those vulnerable groups continues to get vaccinated. We can see, as we've just seen in the last 24 hours, that we can have an outbreak of COVID-19 anywhere in Australia that could then potentially affect anywhere else in our country. We know that that can happen. So for those people who are at most of risk of dying from COVID-19, they really need to be vaccinated as soon as they can be. So in particular, that's that 1B cohort, so that's people who are 70 years of age or over, or people with severe underlying health conditions. It is important that they get vaccinated as soon as they can. Yes, I don't have that number with me, but yes, it's available on various websites. So we do know those numbers, and the Commonwealth, after National Cabinet, reduced those numbers by 30% so that we all have more capacity to manage them.
One last question, Penny.
Minister, does this raise again your government's position on perhaps moving hotel quarantine to other regions?
Oh, look, that continues to be on the table. We know, and especially with the changes around the AstraZeneca, that there's going to be some delay in completing all of the vaccinations for Australians, and so we must continue to be vigilant. We are very alert to the fact that we are seeing increased numbers of big surges happening, including in our region, and that these people are coming into our borders, and we need to try to manage this. New variants coming up. We don't know enough about these new variants and whether they're more contagious or not. So the risk is ever present, and of course we continue to be open to having the discussion with the Commonwealth around Wellcamp. I note that just this recent lockdown and the decision of Northern Territory overnight, they will be housing people in hotel quarantine at Howard Springs. We would love to have that opportunity to do that as well, and to make sure we've got a clear separation between our domestic people, as has been raised today, and our international arrivals.
Who's paying for the city quarantine from Perth, and how come such short amount of notice?
So as we've done before, those flights that were in the air at the time and those people had no choice whatsoever in their decision that arrived after midnight, we will cover the cost of those. Those people who, after we announced that they would be required to quarantine, who still chose to get on a plane, they would quarantine at their own cost.
Okay, we've got to go. Thanks, guys.
Thank you.